So let's talk a little bit about position of the brow and how that affects the way you look. With aging, the brow, it tends to kind of come down a little bit. It makes it look much heavier over the eyes, and the eyebrow position starts to move down lower, starts to move closer to we call it orbital rim, or this sort of prominence right here, and it tends to make people look less rested and older, and sometimes can even interfere with the peripheral vision fields, like being able to see up in this area here. And so there's a few things we can do when that happens. Probably the simplest and easiest thing to do if there's a subtle change in the brow area would be Botox. And Botox, if we treat the muscles that are kind of pulling down on the eyebrows, then that can bring the eyebrows up a little bit and even smooth any lines that are in the forehead. As the condition gets more severe, another procedure that we can do is the brow lift. A couple different kinds of brow lift, really depends on how long your forehead is. Very frequently, I like to personally use the endoscopic brow lift, which is very small entry points, and I hide them behind your hairline so those are well hidden. And then basically what I do is use something like a video telescope, and with that way I can kind of lift those tissues up and get a much younger and nicer appearance of the brow in that area. Another way to do it if you have a very high forehead would be to hide the incision right along the hairline. There's a way to kind of hide that incision along the hairline, and in that way you don't extend the forehead if the forehead's already long, and even can shorten the forehead a little bit in that area, and then you can kind of kill two birds with one stone in that way. Brow lift recovery, many people will take sort of the full work week off to recover from that brow lift because you may get a little bit of swelling. Sometimes it can get some swelling, particularly sometimes can go in this area underneath the eyes. And the other thing, people maybe want more private about it. You likely won't, but you might get some bruising. If you have bruising, you might take that week to get that to settle down. And then frequently people go back to work after that full work week off. And then, as I typically recommend for other procedures, other facial procedures, I do recommend no exercise for 2 weeks after that. Then you do sort of some light exercise, kind of ease your way back into it. By 6 weeks, you need to do just about anything in terms of exercise.